I'd like to give you some tips and tricks about how to talk about occlusion with your patients. Sometimes they'll be challenged to understand how this excessive application of force to their chewing system can do so much damage. So I like to use certain kinds of analogies. Some are auditory, some are visual, some are physical. I'll talk about leg length discrepancy because if one leg's a little bit longer than the other, I can say to the patient, what happens? And the answer is, it depends. Sometimes nothing happens. But if there's too much force on the system, I can be certain that eventually, I don't know when, something will give. It might be just that the patient wears down part of their shoe and their heel prematurely, and maybe the leather gets loose as they overpronate. It could be muscles get sore or knee joints. You see, I don't know how much force, I don't know how quickly, and I don't know which part of the system. All of those variables can be different from person to person, from athlete to athlete. And it also depends on what kind of a shoe they're wearing. If they're wearing Air Jordans instead of high heels, it's going to be a lot more comforting. If they rest and recover well, they may do better than somebody who doesn't. So you see, it's a very complex kind of discussion. I'll also arm wrestle with patients. And I'll say, put your arm up, grab mine, now let's put a little bit of force. And as long as your jaw joint or your elbow is in place and stabilized like it's supposed to be in the joint, and we put some pressure on there, you can feel your muscles work. Then I have them remove their elbow from the table and continue to arm wrestle. And I ask them, do you feel those other muscles becoming recruited and engaging to help hold and stabilize your elbow because it's not braced anymore? They go, yeah. That's what happens with your jaw joint when you clench. When your jaw joint is in the position, in that little hollow where it's supposed to be, and it's braced, you can bite and clench hard. But when you come out of there, the only thing holding it in place are the muscles, just like when your elbow was off the table. And it doesn't take very long, does it, for those muscles to become tired and sore? No. That's why when I pressed on that lateral pterygoid, it was so tender. You see, you can even look at door hinges, and you could say, on that door hinge over there, if I went to close the door and it didn't close quite evenly, and I had to kind of jam it, what would happen? It would depend. Well, maybe it would chip the door frame, like wear and chipping on the teeth. Or maybe my arm muscle will get sore if it's the front door and I'm the doorman opening and closing that door all day. Or maybe the joints would get loose. See, it depends on how much we use it. If it's the back door to the office, that we come in at 8 and leave at 4, maybe we live with it just fine. But if I have an overuse of that system, I'm certain that some part of that system is going to break down. It's these kinds of analogies about the developing anatomy and the problems therein that help the patient come to conclusions about the progression of their disease. You'll find these conversational aptitudes very, very helpful.